I'm Dr. Stefanie Carnes. My doctorate is in family therapy, so working with families is my passion. I'm also a clinical sexologist and a certified sex addiction therapist and supervisor. I've been working in the addiction field for about 20 years, and working with sex addiction, love addiction, pornography addiction has really been my area of focus and passion. There's a lot of confusion about whether sex addiction is a real disorder because it's actually not in the DSM, which is the Diagnostic and Statistical Manual of Mental Disorders. And it was pulled out of the DSM, and the reason that was given at the time was that there was concern that it would be used to get sex offenders a reduced sentence in court cases. And so there was a lot of energy about that at the time. So since then, there's been a lot of controversy in the field about what to call it and the research around it, and is this a real thing? And we just had a big breakthrough because the World Health Organization has put it in the ICD-11, which is the International Classification of Diseases. So now we have a diagnosis of compulsive sexual behavior disorder in the ICD-11, which goes a long way to legitimize that this is a real problem. Working with sex addicts is incredibly rewarding work. Usually by the time that they come to treatment, they're pretty motivated for change. They've had a lot of consequences around their sexual behaviors, and there aren't many people, specialists treating sex addiction out there, and so many people don't know, how to work with them and, the different nuances of treatment. And so our specialized programs really allow us to focus in on compulsive sexual behaviors or addictive sexual behaviors in a real specialized way, as well as really look at the issues that are underlying their addictions, such as traumas and grief and resentments and family-related issues. It's not about what behavior you participate in, it's about your relationship to the behavior. Does it cause impairment in functioning? Does it cause significant distress? The thing that differentiates us from other programs is the depth of trauma work that we get here. There's just no other program that has the level of trauma work that they get here. They make tremendous progress, so it's really wonderful to see the transformations that happen.